Hello everyone, I am Dr. Manish Chhabra. I am a gastrosurgeon with 8 years of experience. I got my training from prestigious institutes of India like Tata and PGI Chandigarh. I am trained in advanced GI surgical procedures of abdomen. I am associated with Uphealth for quite a long time and my experience with Uphealth is quite fulfilling. Today we will discuss very common problem in the society, gallbladder stones. So you can see a lot of people moving with ultrasounds which are showing fatty liver and gallstones. These problems are very common in females, mainly postpartum females in their fourth decade. So now we will discuss how these are formed and what is the best treatment for this gallstones. So any patient, male or female, complaining of pain just after eating food and mainly in the upper part of the abdomen, then he or she should not ignore this symptom. Mostly patient they say these are due to gas, but friends, these are not due to gas. You should get your evaluation as soon as possible by doing a simple ultrasound of the abdomen. If you do the ultrasound abdomen and if it suggests that you have a gallstone, multiple or single, then you must get treated for this gallstone. So these gallstones should not be ignored. This is the pictorial diagram showing the gallbladder stones. This is the gallbladder and these are the stones formed in the gallbladder. Normally there is no stone in the gallbladder, but certain patients develop gallstones. Because of its motility disorder, the gallbladder forms stones. The function of the gallbladder is to store bile whenever you are not eating food. Whenever the food comes, the bile from the gallbladder goes to the intestine and the absorption of the fat is due to this bile only. So by the time the food arrives in the body, the bile is stored in this gallbladder. But if the gallbladder is not functioning properly, then the stones will start forming. And these stones can cause complications. If these stones get stuck at the mouth of the gallbladder, then you can have severe pain and you can land up in emergency. That the gallbladder will distend and it will get swollen. That is acute cholecystitis. Now, if this stone gets slipped into this tract, then you might develop jaundice. That is very severe infection that need to be dealt. These stones need to be dealt endoscopically. So these stones will be removed first and then the surgery of the gallbladder will be done. So the things got complicated and you have to undergo two procedures. Now, if the stones hit this part of the body, this is the pancreas, you might develop pancreatitis. You will have a severe pain in the upper back. And if this is the pancreatitis which get confirmed by blood evaluation, then friends, 4% of the patient don't go home with pancreatitis. This is a life-threatening condition. So to avoid all these complications, jaundice, pancreatitis, cholangitis, you should get rid of these gallstones as soon as possible. There is no medicine available to dissolve this stone. So whatever treatment left to tackle this problem is surgical treatment. And the best surgery throughout the world available is laparoscopic cholecystectomy. It is one of the most frequently performed operations throughout the world. It's not a major surgery. It's a one-day procedure. You have to come to the hospital with prior evaluation. You undergo a surgery. By evening, you take food. And if the things goes well, then you might get discharged next day. So now the only option left to tackle this problem is surgical treatment of the gallstone, which is laparoscopic cholecystectomy. It's a keyhole surgery. Patient abdomen is not cut open. 4 small holes are made and the surgery is performed. It's a daycare procedure nowadays. It's the most commonly performed surgery throughout the world. You come to the hospital on the day of the surgery with prior evaluation, you undergo the surgery and by evening you can have your meal, and if the things goes well, then you might get discharged next day. My experience with Uphealth is excellent. The reason being they take care of the patient in a real good manner, starting from bringing the patient in a cab at a particular time given to the surgeon. Because as a surgeon, I am mainly concerned about the surgical treatment, but they look into all the aspects from the insurance work, TPA desk, all the clearance done by the Uphealth team, and patient reaches to the OT table, and after the surgery is done, they look after the patient in the ward in a real good manner, and they make sure that patient get discharged in a particular time, and all the discharge regarding formalities they are there to help. So I am least concerned about all these things. I am basically concentrating on the treatment part. On pricing aspect, I came to learn that they are doing treatment at the lowest cost as compared to the market price, and they are also providing complimentary 3 days post operative medication, which is, I think, very good.